Okay, hello. Today I'm talking to Maria Constantinou. Hello, Maria. Thank you for talking to us today.
Hello, Rachel. Thank you for talking to me. It's lovely to meet you and be part of this.
And you, thank you very much. So, we'd like to talk to you today about your experience and a little bit about sports physiotherapy. So, perhaps if before we get into the topic of sports physiotherapy, maybe you could just introduce yourself to everyone, let them know who you are and a little bit about what you do. That would be great.
Okay, my name, as you know, is Maria Constantinou. I'm a senior lecturer at Australian Catholic University in Brisbane, and I'm also a secretary on the executive board of the International Federation of Sports Physical Therapy. So I've been involved in sports physiotherapy and also in planning sports physiotherapy programs for a while now. I've been in academia 15 years, recently completed my PhD, which is, yes, quite satisfying to have finished it. And so that's briefly a little bit about me. I have worked at several major sporting events, such as the Athens and Sydney Olympic Games, the Vancouver Winter Olympic Games. I also worked at the Melbourne Commonwealth Games and as a physiotherapist, but also as a volunteer in the 1982 Commonwealth Games as a student volunteer. So that was quite interesting to have experienced working at a major sporting event in any capacity from a young age.
Great. It sounds like you've got so much experience working with sports physiotherapy and teaching it, and especially with the sort of international sporting events, which I'd really like to talk to you about a little bit later on. But first, maybe you could tell us a little bit about your PhD that you've just completed. Congratulations. What was that all about?
Oh, thank you. Well, it's my PhD topic was on gait and physical function in people with mild to moderate hip osteoarthritis. So I looked at function, self-reported function and physical function, and I also did a 3D motion analysis of gait at self-selected walking speeds. And to look at the effects of hip osteoarthritis or the impact of hip osteoarthritis in mild to moderate stages on the individual, with some interesting results and some ongoing research in that area now, which is very interesting.
So, if I can ask you to briefly summarize, what was the main brief outcome of your PhD?
So the main brief outcome is that we as physiotherapists should be assessing physical function and self-reported function in people with mild to moderate hip osteoarthritis, but we should also quantitatively assess gait. A lot of physiotherapists in musculoskeletal area and sports area will qualitatively assess gait, but in my experience, not a lot will assess it quantitatively. In other words, look at gait speed, how fast people are walking, if we can get their step length and stride length. Because in my study, I found that people with mild to moderate hip osteoarthritis compared to healthy controls walk slower, take shorter steps, shorter strides, and they also have less hip extension at the end of stands. And if we look at a functional task of crossing the road, you need to walk at 1.2 meters per second to safely cross the lights, the road at the traffic lights. And what I found, my participants were walking at 1.21 meters per second compared to 1.39 meters per second in the healthy controls. When I followed them for 12 months, gait speed was at 1.1 meters per second. So, in other words, these people are walking slower and to the point where they may not even safely be able to cross the road, which may also impact on their participation in life and everyday normal activities. So, I think it's important as a short message if we can all start thinking about assessing how fast our patients are walking as well, and maybe later on look at how even asymmetrical is their step length and their stride. But at the first instance, to look at gait speed, I will be very, very happy.
Good, that's really interesting. I'm sure you've got, it sounds like there would be a lot of places to go with further research from that topic. So we look forward to seeing more of your work. I look forward to seeing that published and more of your work in the future. I'm imagining
Thank you.
that work wasn't on the sporting population, it was more on normals and the hip osteoarthritic populations.
Yes, our population were over the age of 45, but don't forget that having a hip trauma is one of the risk factors for developing hip osteoarthritis, which is something that happens in athletes. So it is important that if people do have hip trauma or an injury, that we do manage them as best as we can. At the moment, we don't know what we need to do to prevent the development of hip osteoarthritis, and we're hoping to find out more information about that. But it is important that we, if people have had a history of hip trauma, that we do also look at their neuromuscular control and see how we may best address any of the symptoms they're experiencing. And hopefully, we still don't know, but hopefully be able to one day prevent the development of hip osteoarthritis.
Oh, I think we should have you back one day to talk about hips. But today, I'd really like to focus on the sort of your experience in the world of sports physiotherapy. Perhaps how did you get into sports physiotherapy? So there are lots of physiotherapists are interested in working with athletes and getting into sort of sport and exercise, and it can be quite difficult, I think, sometimes to get into working in that sort of arena. So what's your story? How did you become so involved in sports?
Okay, well, my story, my pathway is not the traditional pathway. It's not the pathway of a young physiotherapist who then goes into sports. I was more working out in physiotherapy industry for 14 years. I worked in hospitals, I worked in aged care, and then one day I decided that I needed a change. So I went to the University of Queensland and I said to them, I want to do my master's, and I don't want to do my master's in sports physiotherapy. And they go, right, okay. So, so I did. So I completed my master's in 1999 in sports physiotherapy, and through that we had to undertake sports coverage. So I worked with a soccer team or football team for a year. We had to undertake any other experiences we could. And then after that, the Sydney Olympic Games were actually going to be held in Australia. So I had applied to work as a volunteer. And having had my master's in sports physiotherapy and working at the University of Queensland in the sports physiotherapy clinic gave me then the background to be able to work with the volunteer program of the Sydney Olympics. So that was the starting of my sporting career. And my career is, as I said, it's been more in working with host nation programs. It's been in education, in developing sports physiotherapy programs, teaching, and also teaching overseas and being involved in developing pathways for sports physiotherapists. So I worked at the Athens Olympics. In fact, at the Athens Olympics, we had the support of Sports Physiotherapy Australia to work on a project where sports physiotherapists from Australia worked as volunteers at the Athens Olympics and got billeted by the Greek physiotherapists, which created a really lovely network of physiotherapists. And we had so we all worked in Athens at the Olympics, and we had people from 7 different countries working in the polyclinic, for example, and it was a fantastic collegial international relationship.
That sounds really nice. I think that's one of the really nice things, isn't it, about big international sporting events, is that physiotherapists from all over the world can get together to actually work together, not just learning together
Exactly.
like people do sort of on our courses and things, but getting together to work together. I think the sharing of knowledge across sort of national boundaries is really interesting, especially in a practical situation like that. So that must be really
Absolutely.
interesting.
Yeah, and it was absolutely wonderful. And since then, as I said, I've worked in many other international events, and you work together, but you learn from each other as well. And that's the wonderful thing about it, that you never stop learning, and every colleague has something to teach you, and you've got something to share. And I think that's the beauty of it.
So Okay, so you got into sports through your master's, which is a postgraduate type of degree that we do
Yes.
in the UK and in Australia and in many different countries. Do you think it's necessary to do that sort of postgraduate level training to become a sports physiotherapist? Or is
It's
it enough to just sort of do CPD activities?
okay. It's a good question, and it's not essential that you do a master's to become a sports physiotherapist. I would say it's preferable because you have a lovely structured way of um, covering all the content in all the areas, especially for someone who is got some experience but not a lot of opportunities to develop a lot of experience. In Australia, we currently have two pathways to becoming a titled sports physiotherapist by the Australian Physiotherapy Association. One of them is the master's pathway, and the other one is the experiential pathway. And in fact, we're in the process now of ensuring that the pathway aligns with the International Federation of Sports Physical Therapy competencies um, directly. And it is a way of ensuring through that pathway, a structured pathway, that you cover all the competencies that are required of a sports physiotherapist, which includes, as you may be aware, knowledge about drugs in sport and knowledge about performance, knowledge about injuries and injury management, and returning athletes to sport, which is a very important topic.
So is that written down? Are those competencies written down anywhere?
Yes, they're on the website of the International Federation of Sports Physical Therapy, and they were developed through a Sports Physiotherapy for All project in 2000. They were published in 2005, and they were developed through an international consensus Delphi methodology project. So, and there's 11 competencies, and they're very specific and broad at the same time. And they do cover all the areas that a sports physiotherapist needs to have competencies in.
Okay, and they're so from 2005, but they're still current now.
They are
Yes.
still current,
Yeah.
yes.
So we'll provide a link to those because I think they'll be really interesting to have a look at. I won't try and get you to recall them all now, but so we'll provide the link.
Well, one of the most important ones, I guess, if not recalling them, but mentioning one, and it's one that sometimes when we're developing programs, people tend to forget, is about being a physiotherapist that works in sports. And it's about being able to manage athletes on the field and on the sideline, which is distinctly different from a physiotherapist working in a clinical environment. And being on the field or on the sideline and having to make quick decisions about whether someone can continue to play or needs to go to be referred on or go to the hospital for, or those decisions, or is a different skill set. And it is one of the competencies of IFSPT, and it's one that really we need to be focusing on if we're looking at becoming sports physiotherapists, so that we have those skills on the field as well as the skills that are required in the clinic.
Yeah, interesting. Okay, so you brought up the competencies. That's the one that you would like to highlight. I think it's really important. It is important because it's not something that we get taught in our natural physiotherapy pathway, and it's
Absolutely.
definitely specialist to going into a sporting environment. Are there any? How about a couple of other of the most important competencies that perhaps we don't have as a just through our normal education pathway?
The other competency is injury prevention, and it's being able to implement strategies for injury prevention for the athletes that you're looking after, whether it be a team situation, whether it be in community sport or in elite sport. So that's another significant competency that would be distinctly different from the competencies of a clinician who's working in a clinical environment.
So in relation to injury prevention, what kind of knowledge or skills or both do we need to develop to be effective at preventing injury in athletes?
Wow, that is a very, very huge topic.
Sorry.
But one of the things to bear in mind with injury prevention is to identify intrinsic and extrinsic risk factors. and risk factors that are modifiable or not. So it includes such things as looking at the physical environment of where the play takes place, as well as the training and training loads of athletes, which is a huge topic now in injury prevention. And looking at the athlete themselves and their environment that they're in. So both their intrinsic factors within their own previous injury and recovery, as well as their factors within the environment that they're working in. And I'm not talking about the physical structure, I'm talking about the training, the setup, the requirements as expected of them, and also within their contractual responsibilities. So a lot of those factors need to be taken into consideration in injury prevention, and it includes neuromuscular training programs, it includes training load monitoring, sleep quality monitoring, a lot of those other characteristics.
I'm smiling because that's come up before in other interviews that I've done, and I think that's one of the so load training I'm hearing is a hot new topic at the moment, as well as all the other load training and the things like the sleep and stress management and nutrition as well.
Yes, absolutely.
So can we talk about those? They seem to be sort of new and topical. Let's call it that, topical at the moment. So load training. Load training. What do we need to know about load training?
Well, it's not my area of expertise, but the important thing that we do need to know, and there's a lot of work being done at through the Australian Institute of Sport at the moment, and I can refer you to some of the experts there that you'll be able to speak to. But the important thing is to look at the sudden increase in load before competition. So look at the loading the time spent training in the last week over the previous 4 weeks, and look at that ratio and look at if there's a sudden spike increase in training load, they will be more potentially at risk of injury. So it is important that you, in preparing for events, that physiotherapists work with the athletes and look at their training loads in the preceding 4 weeks. And there's a few articles that have been published in that area. And as I said, the Australian Institute of Sport is undertaking some research with Mick Drew, one of the researchers in the area, and Craig Purdom. So
Craig Purdom and Mick who, sorry?
Mick Drew.
Okay, Mick Drew and Craig Purdom. We'll look out for that. So load training seems to be really interesting, and I guess that's one of the intrinsic factors that you're looking at.
Well, that's more an extrinsic factor because it's looking at the training load that the athlete has to undertake. So it's looking more at what they have to do. Rather, the intrinsic factors are the ones within their own body and their own physiological characteristics.
Okay, so intrinsic factors will be previous injury,
recovery from injury,
that sort of thing.
Yes,
yeah, okay,
exactly.
And the extrinsic factors, so we've talked training load, and then maybe the sleep and stress management and that sort of additional thing. So yes. they aren't skills that we have historically as physiotherapists. Are they things that we need to become more educated in these days and be able to advise
yes.
about them? Or is it just that we work closer with people on the interdisciplinary team if they're available, I suppose?
Well, you raise a very important question, and it is something that we're identifying more and more. The stress and the impact of stress and the psychological factors that contribute to sports injury recovery and return to sport. And it is something that we should be working closely with sports psychologists. We as physiotherapists should be recognizing when we need to refer someone. And I think that's really important that we're aware of it, and we do refer our athletes. And then work together. And managing athletes is more about working as a team. So you don't, having especially elite athletes or athletes that are involved in competition, you need to involve the whole team with the athlete's consent. And that will include the sports psychologist, the sports dietitian, their coach, their strength and conditioning coach, the physiotherapist, the doctor. So once again, I think you raise the issue of the team behind the athlete and the significance of working together.
Yeah, and so that's all very well when there is a team. What about when there isn't a team, say in a amateur athlete or in a less resourced country? What do people do then?
So what will people do? If there are any psychologists, it might be important to talk to the doctor about referring the athlete to psychology if especially if they're experiencing a lot of stress and a lot of anxiety, because that can then impact on their performance as well as the risk of injury. So I think that would be one aspect. I mean, I'm not sure, different countries have different infrastructures, but other than that, we as physiotherapists don't have the formal training, but we do have some skills to assist them with goal setting and and we can give them the basic advice about quality of sleep, the significance of sleeping at least 7 to 9 hours of good quality sleep, and all the other things that we all know. Don't use any digital media an hour before sleep, and ensure that you sleep at nighttime and don't sleep during the day and be up all night on the computer. And making sure that they get into a nice regular pattern to be able to at least, and good quality sleep can also help with anxiety.
Yeah, I think it is important that we understand that we can advise on just those simple pieces of advice that we should know anyway as a human being to operate effectively. So we can do that. And I guess the other thing is that you can always create your own sort of as an independent physiotherapist, you can create your own interdisciplinary team that you refer people to in your local community, I suppose.
Exactly.
Yeah.
And the other thing that's more specific to athletes, and something that we can also, I guess, play a little bit of a role, is that fear of re-injury. Once again, it is important, if we have a sports psychologist, that we refer to them, because we're not the experts in that area, but we need to be aware that athletes may be afraid of going back because they're afraid they'll get injured again. And that fear of re-injury can be a detriment to their performance sometimes. And it's how we address their confidence in being able to be confident in the area that they've had injured and now rehabilitated, hopefully, back to previous status.
Yeah, absolutely. It can be a huge factor, can't it? So we've talked about a couple of the competencies, the important competencies that we need to consider to become sports physiotherapists. What about, are there any sort of specific practical skills that we should develop or that we need to ensure that we have? You've talked about pitch side sort of strategies, so we need those practical skills.
Definitely.
Anything else?
As well as first aid and CPR. So they are essential skills that we need to have, which include taping for injury prevention and taping for injury management as well.
Okay, so you brought up taping. You've written a book on taping, haven't you?
Yes, I have.
I'm going to ask you all about taping now. Can you give us some quick insights into what we need to know about taping and why we use taping, perhaps?
Okay, I mean, there's a very interesting question that's happening now, and it's, well, should I use rigid taping? Should I use elastic adhesive taping, as I call it, or K-tape, as it's commonly known? What should I be doing? Which one is better? And it's interesting, or do I need it at all? And they're all very interesting questions. There's a lot of research being done in the effects of taping, so we still don't have definitive conclusions as to the benefits and the effects of each. But what I would say is, from my experience and what I find useful, is that I now have two tools in my toolbox. I have rigid tape and I have elastic adhesive tape. And I will be selective depending on my patient's or athlete's presentation as to which one I'm going to use. I will take into consideration any evidence I'm aware of, their preferences, what their sport they're playing, what stage of their rehabilitation they're at. And then I will select what I'm going to use in collaboration with the athlete. But as a short, guideline, if I'm needing mechanical support, so if someone is spraining their ankle and they're going back to sport, then I'll use a rigid anti-inversion taping or a basket weave, depending what stage they're at, because I know that provides them good mechanical support. And the way we do the basket weave is using reverse sixes and heel locks and sixes, so a little bit more complex than in some other techniques that are of similar nature. And I find that provides them with good support and confidence to play. And we do know also that taping can prevent second time injury. it won't prevent first time, but it can prevent the risk of, will reduce the risk of re-injury.
So that's
So
taping an injury,
that's
something that's
in
previously
the
been
ankle,
injured.
for ankle sprains.
Oh, okay, yeah.
Yes, taping or bracing.
Yeah.
If I've got someone, for example, with an acute muscle injury, or a cork thigh or a muscle strain or hematoma, I'll use a rigid box tape and it's a technique that's we've got in the book. And there's been some research done by the researchers at University of Queensland as well in that area. And I find that helps to reduce their pain and their increase their range of motion. And of course, I use outcome measures for any of the tape I'm using. But if they're in the later stages of their rehabilitation, then I'll use the elastic adhesive tape, especially as they're returning back to sport with muscle injuries. So these are just some examples of more specific use of tape. Once again, and this is what we advocate in the book and also in practice and in any of the workshops that I run, is that we need to have outcome measures that we use to evaluate the effectiveness of tape. So if we are using rigid or elastic adhesive, so long as we've got some valid outcome measures, be it a VAS scale of pain or the range of motion or performing a functional task, confidence, and then evaluate before and then after and look at the effectiveness of tape. And usually if I can see at least 50% improvement in their symptoms, then I'll be confident enough to leave the tape on. Except if, of course, the athlete really wants it and they want that pink elastic tape or K-tape because they've seen someone else wearing it and that will make them feel better, then sometimes that will be good enough reason for me to use it.
Yeah, well, exactly, yeah. But psychologically, it might make them perform better.
Well, it's interesting. We did run a very small study looking at the effects of sham tape, elastic adhesive tape, and rigid tape in non-injured community athletes, and looked at the effects on different performance tasks. But more importantly, we asked them about their perception of performance and their confidence. And there was no difference in the performance with any of the tests and with any of the conditions of taping, including no taping. However, when they felt the tape was more comfortable, which was the elastic adhesive, they thought they did better, but they hadn't. So that was interesting.
Yeah. So just coming back to the rigid tape and the elastic tape, how do you choose between the two? So you said the rigid tape for mechanical support, and then just how would you decide which one to use?
It is. There are no clear guidelines into deciding which one would be better to use, and that's why sometimes we do have to go by preference. But there are some techniques, as I said, and those couple that I mentioned that I know work really well in the rigid, for example. But if I'm wanting to allow more mobility as well as give them some support or some feedback, some increase their awareness of the area they need to be thinking about activating, or increasing their perception of where they need to sort of be protecting, then I might use the elastic adhesive. But as I said, with any case, I will use outcome measures. And if I don't see it's benefit them in any way, I will remove it.
Yeah, good.
So it is more about, and look at the evidence. There are some good articles now coming out. There's some good taping techniques you can use, for example, for back pain, that provide that increase feedback and support. So it's looking at the evidence. There's some good techniques for the shoulders, and so it's more about looking at the articles that are coming out and being able to evaluate what the information the articles are providing us, and then how we can then apply it in our own practice.
Yeah, good. And just to be clear, I think I understand that there aren't any specific outcome measures for taping particularly. You need to choose an outcome measure that's specific for the injury or the part or the knee or whatever.
Exactly. Specific to the athlete and specific to their goals and specific to what you're trying to achieve through the treatment. The one thing to be aware of, since we're talking about taping, is the fact that there are hundreds and hundreds of brands of tape on the market today. I think there's more than 300 to 400 different types of elastic adhesive tape. There are different thicknesses, there are different weave patterns, different glues, different stretch components in each one of them. In terms of the effects, pretty much of a muchness, but there are, in other words, what I'm saying is that it would be similar across most of them, but it's important to be aware and to become familiar with what kind of tools you have within your clinic. So which type of tape is being used and which one is, and learn how to handle it so that you can then become more efficient at using it when the time comes.
So practice on each other.
Practice on each other is good. And the other thing is that because each one of them may have different glue or a different chemical components, sometimes people might react to one but not the other. And not every manufacturer will disclose what materials they've used, what chemicals they use in the glue. So it's important to be aware that to look at the possibility of people reacting. And they may, if they react to one, they may not react to the other. So it's good to do a nice little test with a small piece of tape to see if they're going to be reactive or not.
That's quite good to know.
As a safety precaution.
Yeah,
yes.
That's good to know. That is good to know. Okay, so before we move on, anything else on taping? Are there any other big messages that we need to know about taping other than that you've already just mentioned?
I just think it is the only tool I take with me whenever I travel. I think it is very useful, but I think we have to be discerning in terms of deciding when to use it.
Yeah, good. Okay, good. I think that's been really useful on taping. Okay, so we've talked about pathways and practical skills, and I'd really like to talk to you about the big international events that you've been at. What's it like as a physio?
It's fantastic. As I said, I worked in Canada at the Vancouver Winter Olympic Games, and in Athens, and in Melbourne with the Commonwealth Games, and it's really it's exciting. It's being part of such a big major event, meeting so many wonderful people. But the other thing that I found very rewarding is having worked with the host nation programs. Quite often we are working with athletes that may not have had the privilege of having had physiotherapists in their own countries, or physiotherapists travel with them. And quite often we're seeing injuries that have been long-standing, and being able to help them and help them achieve some of their goals is very rewarding. And we've had instances in those events when we've had their physiotherapists come into the polyclinic with them, and we met and discussed and learn from each other. But or we've had them come with their doctors because they have no physiotherapists in the clinic, and we've been able to then communicate with the doctors as to what's happening. So they're some of the most rewarding experiences of working at those larger scale events.
That's really interesting. I'd never thought of it that way before. So you're talking from a point of view of working in the main medical centre of the event, as opposed to being a physiotherapist travelling with a team, aren't you?
Yes, and also working at the sporting venues. So working at the athletics track, working at the gymnastics stadium. And these are the major ones. But I also had the experience last year of working at the Pacific Games in Port Moresby in Papua New Guinea, where we had 4,500 athletes from the Pacific region. And we actually assisted with the training of the doctors and the physiotherapists and the medical students in Papua New Guinea to train about to work in a sporting environment, because a lot of them are clinicians working in hospitals but did not have the experience of working in a sporting environment. And so we worked with them and helped on the field and in the clinic, and really helping them to get those skills and enjoy and love them and look after all the athletes from the Pacific. But the interesting thing was too that there are so many athletes that came from small nations that do not have a physiotherapist on the entire island. They have one doctor for 100,000 people. So it was a real privilege as well as pleasure to work with them and to be able to help guide them in some of the things that we've talked about, in injury prevention, in injury management, in being able to think about their rehabilitation. So hence we've been also undertaking a lot of training in the Pacific Islands to train their doctors and their physiotherapists and their nurses, if they don't have physiotherapists, in how to manage athletes' injuries on the field and henceforth.
And I guess there's two things that come to my mind when I listen to you talking now. One is that I imagine you learn so much from them as well, from having to do
absolutely.
sport in such in a different environment and such a different context. So are there any major things that you've learned from these people, these athletes that you've been working with?
I learned about their resilience. They are resilient. They are amazing. And but also the thing that I find with some of these athletes is that they do so much. They have very little infrastructure. They have very little support in terms of physical environment. In one of the islands we went to, and this is, it's going to make some of our viewers even feel sad, but we have a young soccer team and they don't have soccer boots to train with. So if someone gives them, donated some soccer boots. So what they did is they actually wore one each. They shared a pair of soccer boots so that no one could be without a soccer boot when they're training. It's not ideal, but for them, it made them feel better because they're all about the family and the team and sharing. The other thing that I learned from these athletes is that for example, there was one athlete who was an 800-meter runner, but because they had no other athletes within their small nation, they were made to run the 1,500 meters, the 4x400-meter relay, the 800-meter, and the 4x100-meter relay in 5 days, by which time they were hobbling along trying to complete their race. So I've learned that if we can help them in any way to be able to look after themselves better and their training, I think we'll be doing really well. So, but that's what I mean about resilience. When you see these athletes and what they go through, their resilience is absolutely astounding.
And for people, for the athletes and the healthcare professionals that are working in those contexts, is there any sort of advice that you give them for managing within those contexts?
Are you talking people that have the experience or people that don't have the experience and have to work in that context?
Either, really. Either. Both.
Well, the health professionals that don't have the experience working in a sporting environment, it's really useful for them to do some training and to attend first aid, CPR courses, be able to manage athletes on the field and also practice the scenarios to be ready for events like that, because quite often you can say this is what happens, but when you go to the practical aspect of it, you find there are hurdles that you haven't thought of. And we've encountered some of them in different events, and we're able to learn from them. So it's about planning and it's about being prepared. Whereas, well, I guess the experienced health professionals, they could advise me. I wouldn't be able to give them as much advice because they do it every day. It's their bread and butter.
That's fair enough, definitely, and that's where we learn from each other, isn't it? It's like we all learn from each other, and that's like with the discussions that we have in Physiopedia and things. It's so nice to have people from all different contexts, all discussing the same topics, and we learn from so much from each other. So, okay, so in these. How would you advise someone who wanted to be able to work in one of these high-level international sporting events, like the Olympics or something?
Yes. It's a question I get asked all the time by students. As I said, I've been, and young physiotherapists, how can I become a sports physiotherapist? What do I need to do? And one of the messages that you'll hear from many sports physiotherapists is you've got to be prepared to do the hard yards. You've got to be prepared to work long hours, sometimes unpaid, unfortunately, or very minimally paid. You've got to be at the right place at the right time, and you also got to get involved. And that's the biggest message I can give somebody is get involved, whether it be volunteering to help, get involved in your associations, get involved in your institutions that are running programs, in terms of sporting events or so. For example, in Australia, the best way to do it, and because I know the system quite well, is we have a lot of community sports. There are a lot of teams that do not have first aid coverage. They don't have a physiotherapist, or there are physiotherapists that are working in the community sports and they require assistance. So students in Australia can do a sports trainer course, which is a 2-3 day practical course to sports medicine in Australia, and that gives them the ability then to do the injury management on the field and refer on, of course, not to treat, not to work as physios, but to work as more first contact injury management. And so get experience in that area or shadow a physiotherapist that works in that area, offer to go and help them, do taping courses, do first aid courses, CPR courses, make yourself useful. Really important to make yourself useful. And so when positions come up, people will think of you and say, well, we had that young physiotherapist and he shadowed us for a while, but he was so useful, so good to have around. Let's offer him a job.
Yeah.
And so you can start from community-based sports, looking after teams, working from there on as you get more experience, get more training, develop your skills and your competencies, then you can start applying for more major sporting events. For example, we've got the Commonwealth Games coming up at the Gold Coast in 2018 in Australia, and they're soon going to start asking for volunteers. So if you have the experience that you can actually put in your application, that you've worked in sports, you're familiar with the sporting environment, then that you may get selected. You may not get to work as a sports physiotherapist, but you may get to work in athlete support. It still gives you an insight into a sporting event. You get to know the people, you get to understand the culture and the ethos, which will then help you later on. And from there on, really, it's about slowly getting more experience and climbing the ladder. And when opportunities come along, don't say, oh, it's not paid enough, I'm not going to take it. Because if you say that, quite often it's not going to happen. And when you're working as a physiotherapist traveling with a team, for example, even at a community level, you've got to work long hours. If you're traveling with a team, quite often you're the only health professional there. So you might need to work 23 hours or 20 hours. So it's about being prepared to work and enjoying it and really getting the most out of it. Get involved. Be prepared to be at the right place at the right time as well and take on opportunities.
Yeah, definitely. I think it's definitely what you're saying. It's a message that I've heard before talking to other people in the sports environment, that people have to work hard and have to really get involved and make it, make it their passion and kind of,
Yes.
really become dedicated to working in the sport maybe that you choose, I guess, a sport that interests you or a situation that you can become involved in. And if you can do that, then your physiotherapy skills will get you through the rest of it.
That's right. And undertaking further training, I think, is really important. So doing a master's degree always reflects very well if you've got the opportunity to do a master's in sports physiotherapy or something similar, taking continuing education, professional development in the sports skills and training, and then getting the practical skill as well to put together, I think is important.
So you run a master's program there where you are, is that right? Or you?
No, at Griffith University. I was previously at Griffith University, and they have a master's in musculoskeletal and sports physiotherapy program, which I instigated and helped set up in 2007.
Yeah.
So that and I was convening the program for 4 years before I moved on to finish my PhD. But that program is still currently happening. So there are Griffith University, University of Queensland in Australia have a master's program in sports physiotherapy, Curtin University, La Trobe University, and University of South Australia.
Yeah.
So there are a few universities in Australia, but there are also a few in the UK that have master's programs in sports physiotherapy as well.
Yeah, for sure. And you mentioned, so you also, I can't remember if you mentioned this when we were talking before we started recording or not, but you mentioned that you were doing some training overseas as well in the in the South Pacific region. What kind of training how do people get into that? Are they just courses that they need to find out about and just go on?
Yeah, what we've been doing is usually we've been invited to present. So we've been presenting courses in sports physiotherapy as well as on-field injury management for physiotherapists with Mark Brown. And in disclosing that Mark Brown is my husband, but also a very well-renowned sports physiotherapist in Australia and my co-author of the book, Therapeutic Taping for Musculoskeletal Conditions. So we have here, Mark is also on the ONOC Medical Commission for Oceania Olympic Committee. So through that, we've done the Pacific region. He was invited to present workshops with myself and Dr. Chris Milne, a sports physician from New Zealand. So we held workshops in Fiji, for example, in Papua New Guinea, as well as in Yap, Micronesia, to help train some of the local medical team in managing injuries, as I said before, on the field and rehabilitation and injury prevention. But we've also been through Sports Physiotherapy Australia, the Australian Physiotherapy Association. We were invited to present a level 1 sports physiotherapy course in Hong Kong in 2014. And we're also been invited to repeat that course in 2 weeks. So we're presenting in Hong Kong in 2 weeks. We were also invited by the Indonesian Sports Physiotherapy Group to present the Level 1 Sports Physiotherapist course in Jakarta in July. But we've also done smaller courses. So we presented on, Mark has got an expertise in presenting courses for physiotherapists for managing on-field injury management and learning some of those skills that you really need to, the quick decision making that you need to have when you're working with athletes. And I've also been doing a lot of courses on assessment of ankle injuries and shoulder injuries and knee injuries, as well as hip, of course. And we've helped them in countries like Italy and Cyprus and Greece, and we've held taping courses as well, and we try and focus the taping courses to be more on musculoskeletal taping and injury prevention and injury management. So it depends really. We don't actually seek out to do the courses, but when we get invited, we do like to help, and we do it more because we like to help our colleagues. And when the opportunities come, as I said before, you get involved and you weigh them up and you take them if they're going to actually be helping someone.
So it sounds like there isn't one particular list or one easy place for people to go to find out about the courses, but at the risk of inundating your Twitter account, people could maybe send you, if they're in Jakarta, could send you a quick message and say, hey, when's your next course in Jakarta or something?
Yes, of course. And I could let them know. I'm sure the Sports Physiotherapy Group in Indonesia would be very happy to hear that. Yeah. And so in fact, we've managed in the last, how many years I've been delivering courses, I think we've covered about 20 countries that we've taught in.
Well done.
Different workshops, taping workshops, or different musculoskeletal assessments. And so in that case, and we are happy when the opportunity enables us to do so, to do help with courses. But I am a full-time academic, so I have to also work within my own environment here and within the time I have available to me.
Yeah, good. Okay, so good. So I think we've covered a lot there. It's been really interesting to talk to you. Are there is there anything in particular that we haven't covered that you think is a big message that you'd like to leave everyone with?
I think we have covered most things, but one of the things I just want to reiterate, one of the words you used before, and to be a sports physiotherapist, you have to have the passion for it. You've got to enjoy it, you've got to love it, and you've got to make it not just for the benefits that they give you, whether it be money or reputation. You've got to be there because you enjoy sharing those moments with the athletes and sharing the opportunity to help them achieve their best.
Okay, I think that's a really good message, and I think that's a lovely message to leave on. So So we can find you at on Twitter.
Yes,
What's your Twitter name?
Maria Constant.
Good. We'll provide a link to that. Is there anywhere else where people can find out more about you and about what you are up to, what you're doing?
I'm on LinkedIn as well.
Yeah.
So so they can connect with me through LinkedIn.
Okay, good. Okay. All right. Well, Maria, thank you very much. It's been really lovely talking to you today. Thank you for all the advice that you've been able to give to all those budding sporting physiotherapists out there. It's been an absolute pleasure talking to you.
Thank you very much, Rachel, and well done on the work that you do. I think it's wonderful, the messages you get across to all our colleagues. And I wish everybody every success and every opportunity you can. And yes, all the best to everyone.
Great. Thank you.
Thank you.